From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
Welcome back to this special edition of Inside the 1581. I'm Rich Rasmussen, President and CEO of the Oklahoma Hospital Association. As you've heard in our other segments, we're here at the 2025 OHA Connect conference. It's an annual conference that the association hosts. It's not exclusive to hospitals. We have hospital leaders here and others across the healthcare community. And as I mentioned early on, we did celebrate some real significant milestones on Tuesday with the Oklahoma Perinatal Quality Improvement Collaborative. It's a collaborative that focuses in on how we can improve the opportunities, the health opportunities, and health outcomes of moms and babies. And so we learned on Tuesday that Oklahoma was recognized nationally as ranking 12th in maternal morbidity. And so, you know, the bottom line for folks that may not understand all that verbiage, it means we're doing a really good job of helping moms prepare for the delivery of their babies. And so we do know, based on the next level of data, which won't be announced till next year, but will be number 10. So here is a top 10 example of what hospitals are doing to create the best environment for moms and babies. And so it's something we're celebrating here. And I'm joined with Darin Farrell, who is the CEO of Weatherford Regional Hospital. And so Darin got a chance to hear some of this information, and I think we've all celebrated that, as well as other information and educational learnings that we've had here at the conference. And so I'm delighted, as part of our voices, having Darin spend some time with us. Darin, welcome. I think this is your first time on the podcast.
Yes, sir. Thanks for having me. I'm excited about it.
And Darin comes from Weatherford, and Darin, you're an RN, and so you've dedicated your entire career to being a healer. That's right.
You know, I felt called from a young age to work in healthcare, but you know, to be completely honest, when I was a kid, I really wanted to be a doctor because they make a lot of money, you know, so that was the driver. And so I, started college and then started working at a hospital and as a transporter and nurse's aide and unit secretary. I floated all around and in Ardmore, Oklahoma. And then through college, you know, I was pre-med for a while and then changed gears and decided to go into nursing, and so did that, then went back for management. And so I say all the time, I grew up in a hospital and got my first administrator job at 30 years old, and you know, now I'm in my 50s and been having fun ever since.
Well, in the first time I had a chance to meet you, it was behind the wheel of a high-performance, really fast automobile. And so for our listeners, Darin and I had a chance to do, it was cool, wasn't it?
It was.
We had a chance to go do this Porsche driving experience at a racetrack. Was that near Stroud? I can't remember where that racetrack was.
Yeah, like maybe north of Stroud or somewhere up in there, yeah.
And so first time I had a chance to meet Darin, and here we are taking turns, hitting the turns at 100 miles an hour, you know, in a really cool car. And so that was a lot of fun.
It was. You talk about, you know, getting to know somebody and instantly needing to trust them. You know, we were.
That's a good point. Well, I felt really good trusting you because you're a nurse, you know, so I know if I do something wrong, I know I've got someone who's going to be good first aid. So that was a lot lot of fun to be able to do that. And I think that's indicative of, you know, when we're in healthcare, the relationships that we create, you know, in one sense, yes, trust is a big part of it. And it's trust is at the foundation, I believe, in the delivery of good care as we trust our caregivers that deliver that, whether it's to ourselves or to our family members. And it's just a testament to what you and your team members do every day, Daryl. And so with that, you and your organization is incredibly unique in our state. And that as a critical access hospital, and I think I've explained this to our listeners before, but if you're new, a critical access hospital is a very special, unique creation of federal law. It's a hospital that has less than 25 beds or less, more than 35 miles from the nearest hospital. There are a couple other qualifiers in there, but the bottom line is that these are the facilities that are serving our rural communities. And in Oklahoma, I believe we have 6 frontier communities, one of which not far from you. I think Shattuck is serving a frontier county. But these are really special facilities. And we have 38 of them in our state, and only one of them remains that delivers babies, and that's Weatherford.
Yes, sir. And, it's been important to that hospital, the community, the board, that we retain the OB services. And, we deliver between 250 to 300 babies a year. And many of those mothers drive an hour to get to us. And so if we weren't there, then they would have, possibly another hour to drive to get into the edge of Oklahoma City to have their babies. And so it's a safety thing for our area.
Sure.
That we're able to provide that. Of course, all emergency rooms are equipped to do an emergent delivery, but having it, where it's planned and the actual labor and delivery, it reduces their risk so much. And so it's been important, even when it was financially very difficult. The hospital board, the administration before me, they always felt that because the community needed it, that they would make sacrifices to keep it going. And so it's remains one of those very expensive services for a small rural hospital. And and with most of the patients not having a great payor for that, it creates some challenges. And so,
well, and you're absolutely right. I think for most folks don't realize that when you look at the expense related to offering obstetrical services in a hospital like Weatherford, and correct me if I'm wrong or fill in some of the edges on this, Darin, but you have to have surgical services, you have to have anesthesiology, you have to have an obstetrician, you have to have the ability to handle, step down in terms of transfer if that baby needs to be transferred to a NICU. You have to have all of these pieces that flow into that, as well as having additional medical supplies that are uniquely built and designed for newborns as well as moms. All of that goes into a cost structure where hospitals, as it relates to obstetrical services, is significantly lower than any other service that you'll have.
Right.
And you try to pencil that out. And I don't know of any organization that can generate any margin on obstetrics. It's all of the services. So it's very easy to eliminate obstetrical services and have a better margin.
Exactly. And so, that's something that, especially as we look forward at what Medicaid cuts and things are coming, that those decisions, are going to be some that we're going to have to really seriously look at. If you're going to keep rural hospitals open like ours, then we have to look at all services. And when you've got that particular service, even though we know how important it is that we keep it for the safety of the people that live in our area, to be able to have their babies in a safe, healthy environment. You just mentioned earlier about the maternal outcomes improved so much in Oklahoma, and we're at the top end of that. And
isn't that exciting, though?
It
is. For
is,
so
yeah.
long, if you look at our overall state performance at 47th nationally, we know that our clinical performance is probably in the median when we look at things like surgical complication reductions, readmissions and things like that. But we are top 10 as it relates to, taking care of moms and delivering babies. The next step is, working with the legislature to now put the resources in the community to support a mom and that young baby to be successful and to be successful in our schools going forward.
Yeah, and of course, you and I can't dare to even step across this line, but thinking about being a woman in labor, I mean, you don't want to drive any farther than you have to. I mean,
absolutely.
You want
as a dad, you want to protect your spouse, and your newborn that's coming.
Right.
Yeah. And so for you in your shop, so let's talk about this a little bit. I mean, we've mentioned in our other two voices, this $6.7 billion in Medicaid cuts for your organization. Maybe what your directed payment. Do you know what your directed payment amount is?
Yes, it's about $4
million a year.
Mm-hmm.
So you as an organization and a critical access hospital serving a small town in Weatherford, $4 million a year is going to be removed from your resources. And if we look at that over the course, of a decade, it may be as much as $40 million.
Right.
Right.
Yeah.
And so how, as a board, I am sure this is really a gut-wrenching conversation that you're having as you're trying to, plan out over the course of this next decade. How are you going to, almost in the hierarchy of needs, right? You need to have emergency, department, hierarchy of needs,
right?
And surgery, having that so that you can have the sustainability of those services and revenues coming to it. I'm sure OB gets harder and harder to do that when you're going to be looking at a reduction of $4 million a year.
Absolutely. I mean, that one, it's probably at the top of the list that we would have to consider. Can we afford to keep that going when we are looking at the survivability of the hospital and that emergency services? And so every one of those services, we're starting to look at the details of them, their expenses versus their reimbursements, and then trying to predict what the future reimbursements will be based on all the changes that are taking place, and trying to weigh all of that out. And as we get closer and closer to when the cuts go into effect, then those decisions will have to be made. And of course, we're also hoping that with enough advocacy and communicating with our legislators and being able to show them what this truly is going to do to healthcare in Oklahoma, rural Oklahoma, America, that maybe we can change some things before the cuts go into place and fill some of that gap without removing access to care in the rural areas, because that's what it looks like we'll have to do at this point is reduce access to care unless something changes.
So let's talk about that access to care. So, I mean, we mentioned a little bit about what you're doing in maternity, but again, the hierarchy of needs in a community, emergency room care, you all and your team just responded to what could have been an horrific event. And had the community not had a hospital, had the community not had the team in place to respond to a most recent, chemical release in your community, lives would have been lost.
Absolutely.
And so tell us a little bit about that. For those of you who hadn't been watching, there was I believe it was ammonia release.
Yeah.
So why don't you walk us through, Darin, your team was responsible for literally saving lives in this example of something that happened in a rural town. And had you not been there, lives would have been lost.
100%. So a semi-truck hauling anhydrous ammonia, the driver had stopped at a hotel to spend the night, and the truck was leaking badly.
I saw the video. I mean, it was really bad.
It looked like a horror movie with that big cloud of gas. And so what happened was it was parked right next to the Holiday Inn, and guests started waking up and not being able to breathe. And so police were called, different emergency services, and So what happened, we ended up over about a 2-hour period. We had 34 patients come in. A big section of the city of Weatherford residential area was evacuated. They had to find shelter for them over at the university, but so we got a surge of patients. Our hospital has an 8-bed ER. When the patients started arriving, we called in extra nurses, extra doctors, because we staff with a small amount of people. But because we're equipped and we had what was needed, we were able to treat those patients quickly, giving them the breathing treatments, the steroids, the things that were needed to treat that condition. Because this ammonia, it burns the airway. So then that causes inflammation, which can swell your airway and close it off where you can't breathe. And so, we were able to decontaminate. We had to decontaminate those patients, wash the chemical off, and give them the treatments that they needed to prevent their airways from closing. 10 of those 34 initial patients were critical and had to be transferred to higher levels of care to the Oklahoma City hospitals with ICUs. And so having the rural hospital there, no doubt, patients, we were about a mile from the hospital, from the hotel where the leak was. And so patients were able to get there in just a matter of a few minutes, and we could start treatment immediately. And then, the relationships that we have with other rural hospitals and really all the different services in the state. The health department put together the regional trauma advisory boards years ago, and so there's occasional meetings that happen. So because of those things that are in place too, phone calls went out to activate those mutual aid services. So again, in a small town where you have limited EMS service, our town typically has 2 ambulances on duty. So they called for help, and we ended up, I'm not exactly sure how many ambulances came, but they came from all over the western part of Oklahoma to help. And we ended up with 5 helicopters that came through air evac. And so though we were able to do the initial treatment there, and then get those patients sent to, most of them went to St. Anthony Hospital, because we have a management relationship with SSM Health St. Anthony. But we were able to work quickly. And so you hate to think about not having a hospital there with emergency services and being able to do what we needed to do. There would have been a lot more serious injuries. But we can say that it was a successful event as far as that goes, because that happened on Wednesday night, and all of the patients were back home by Sunday.
Yeah, that is a miracle. As a recovering volunteer firefighter, we trained, our fit testing, everything else we trained for a hazardous condition, not being a hazmat volunteer firefighter, but I have appreciation for that, and I have appreciation with a long history with the Coast Guard of how important it is to plan and to practice and to drill for these things. And I think as a nation, I think here's another example where there's an underappreciation of what the federal government has done, post 9/11, post anthrax, in West Palm Beach, was we put resources into states for state public health, for hospitals, to plan, design response plans, and to practice those response plans. And I think where we are now, we can't lean back from that. We have to continue to lean into that. And I think Weatherford's an example of we can examine it and say, thank goodness we had plans in place. We had people who were used to working together. We had response plans that when we execute them, we know how they're going to play out, and we have good outcomes. Mm-hmm. And so, hopefully, as we move forward as a nation, as we move forward as a state, we don't step back from the resources that we've made available, because in Weatherford, I think it may have been as much as 57 people involved in that who are alive today.
Mm-hmm.
Because the plan worked, you had the resources, you all responded, and people have now the opportunity to spend Thanksgiving with loved ones.
Absolutely. And, I'll just add one other thing to that is in our rural hospitals, sometimes we don't get enough credit that the clinical folks that work in the rural hospitals, the nurses, the respiratory therapists, the pharmacists, everybody, they actually have to have even more skill than some of the larger
Yes, they do.
facilities, because they've got to be ready for everything.
Yes.
And whereas in some of the larger facilities, they might be more in a specialty area and they focus on kind of one type of patient and things like that. And in the rural areas, there's not a team for this and a team for that you can call and get
Sure.
them to come down the hall and help. It's you and a couple others, and jump in there and do it. And so they just did a phenomenal job. Our staff there at Weatherford Regional, along with all the local law enforcement and fire department, EMS. It was amazing how skilled medical folks came together and really saved that.
That's a testament to good planning. First receivers, first responders working together.
Mm-hmm.
And having good outcomes.
Right.
Darin, you served on the board of OHA before,
Mm-hmm.
and now you're back. And we're delighted to have you back. You've been elected by your peers from our region that reflects Southwest Oklahoma, which is kind of interesting because Weatherford, way our boundaries are done, you're probably more central Oklahoma and Southwest, but you're going to be representing your peers on our board. As you look at the next 3 years, what is it that you hope to have influence over for OHA? I would argue we have really tried to strike the right balance for our rural hospitals and our metro community hospitals. When we look at how we developed the Medicaid expansion, it was, a big part of that is making sure we had more access to care for rural Oklahomans. When we did and worked with the legislature and the governor on our managed Medicaid and how we developed our directed payment program, we did it in a way in which our critical access hospitals aren't subject to the hospital fee that pays for expansion, and it drives your directed payment. And that was purposeful to be able to support our critical access hospitals. And that's something the association worked on, among others. And so for you being one of our voices, and it's going to be great because we're going to have 3 critical access hospital CEOs represented. You're going to have Tiffany from Poto, you've got Tom in the Northeast from Shattuck, and then now you representing the Southwest. What do you hope to have as your influence with our board and with your metro partners?
Well, what I'm really hoping for is that I will have relationships with all of the hospitals in our area where they feel like that I can represent them. I've been an administrator now for almost 23 years. And so I've been in, this is my second critical access hospital, but I've also been in hospitals that were a little bigger and part of big systems. And so I feel like I'm a little more well-rounded as far as all that goes than I was the first time I was on the board. And with all the different changes that, of course, healthcare has been forever changing.
It evolves every day.
Yes. And especially with the funding, I understand that more than I ever did before. And just communicating and being able to be at the table when the hospital association is asked or is in the middle of all of these things coming. We got the Rural Health Transformation program that's coming out. And then hopefully we can influence changes to these drastic Medicaid cuts that are coming. And so I'd love to be a part of that and be able to just use my own experiences from the hospitals where I've served, and be able to tell that story to who needs to hear it, and influence change, and change for the better for the hospital rather than change for the worse.
Absolutely. And we're so delighted when you do participate in some of our second mile engagement opportunities like the American Hospital Association. When we go to the annual meeting, which you were with us last year, being able to tell that Weatherford story, just the beauty of, hanging in and providing that OB for those 200 moms and those 200 babies that you guys were able to welcome in was so important. And so as we wrap up our episode here, and certainly the Connect conference, you've heard a couple, keynotes. We're going to hear Luke Russert here a little bit, and you've been to some of the breakouts. Is there any takeaways that you have that you're going to, maybe it's an aha moment, you made a note to yourself, that you're going to take back to your team, or if your team members are here, that you guys are going to talk about it. Anything that you've learned that you thought, wow, okay, that's insightful, I'm going to use that.
Oh, of course. Yeah. The presentation earlier on AI,
right.
And of course we are all seeing AI. Most of us may be using a little of it, and that's fascinating, and how it is affecting healthcare already, and then looking at how much more healthcare will be affected by AI. It's really unbelievable, but it's here. It's already here, and so that I've really got that to take away. But there's been a lot of great things, and I've been coming to OHA Connect for many years, and the networking, the vendor area here, getting to see all the services maybe I didn't know about, interacting with the OHA staff, and interacting with other hospital administrators and staff from all over the state. It's just an experience that you can't replace with something else. So it's a valuable conference to come to, because this is our state. These are our people. And when we talked about being an influence on the board, us all coming together here gives us that time to influence each other and share the ideas that we need to take further. And so my biggest takeaway every time I come to OHA Connect is really the networking, and being able to share ideas, and or hearing what like the topic that's coming, and then I'll discuss it. Wow, what are you doing to prepare for that? And
right.
So it's that's the biggest thing for me is really just connecting with all the other folks.
Well, and I think you've nailed it. And from our other voices this morning, shared the exact same response. When we do come together, it's different if you're going to a national conference where you may not be with another peer from your state, or you're going to a GPO conference, and particularly if you're a small provider and you're grouped in a meeting with very large integrated systems, you have little in common. But when we're here together, we're peers, we do learn from one another. And in the example that you used earlier with the ammonia spill, you have the opportunity to learn who you can lean on when you need them. Mm-hmm. And I think that's really important. And so, our third of our voices here today in our special episode of Inside the 1581 has been Darin Farrell, who is the CEO of Weatherford Regional Hospital. And we've been delighted to hear some stories from his part of the state as we celebrate this year's 2025 Connect Conference. I just want to say thank you for folks for listening in. I want to thank Alex Taylor, who's on the other end of the camera and the mix box here, helping us every time we produce one of our podcasts as our producer of Inside the 1581. And certainly Susie Wallace, who is our VP of Communications, who kind of really oversees all of it. And so we're a real big team here at OHA, and I appreciate everyone who has made this conference a success, our members who have participated in it, and certainly our vendor partners who help underwrite the expense of this so that we can provide great education and networking opportunities for our members. So again, until we meet again on Inside the 1581, thank you for joining us. And we look forward to a next conversation about what's happening inside the great state of Oklahoma within those 1,581 miles of the border of the state of Oklahoma. Thank you.